Hi, Dr. Barker here at Pete Plastic Surgery Center. So a question of how long should I wait after a pregnancy to undergo a Mommy Makeover is one that we receive here at Pete Plastic Surgery Center all the time. It is a great question because mothers that have just had a child or had a child in the past that is hoping to improve the contour, the look, the placement of breasts and or body, which is a Mommy Makeover, is something that is very personal and is very important to these women because they have just brought a life into this world or did in the past, and now they are looking to invest in themselves to secure more self-confidence, to be more proud of how they look and or just to feel better for themselves. So when we're looking at timeline after pregnancy to undergo a Mommy Makeover procedure, what I always am telling my patients is that I like you to wait minimum 9 to 12 months. And there's a reason for these numbers. One, when a woman gets pregnant and has their child, hopefully happy and healthy, afterwards, whether they breastfeed or not, their breasts are going to engorge with milk. That will take months upon months to resorb if breastfeeding has not taken place, or even after stopping breastfeeding, it can take time for the breasts to get rid of all that engorgement and get rid of all that milk through the ducts. We want to make sure that that has plenty of time to take place. And that typically we will say, we want you to be done with breastfeeding, or if you haven't breastfed, we want you to wait at least 6 months. When we're talking about the body, typically when we talk about Mommy Makeovers, we're talking about tummy tucks or abdominoplasties. This is also extremely important because one of the main factors in a tummy tuck or an abdominoplasty is fixing the separation of the abdominal musculature that happens while pregnant. Because while the uterus is growing inside mama, it has to separate the abdominal musculature to keep room available for the rest of the internal organs. But that line between the two separate abdominal musculature groups is called the linea alba. This linea alba is a fascial layer with no muscle on top or below. And if you know anything about fascia, fascia does not contract necessarily like a muscle does. So once it stretches to a certain amount, typically over 4 to 5 centimeters, it can never go back to zero. Now it may go back to an amount where you don't see it externally, like with abdominal distension, or always appearing that you are bloated or full. However, many women will have it remain around that 3, 4, 5 centimeter gap and always have rounding of their abdominal wall. But we won't know what the permanent or end result of that separation will be for around 9 to 12 months following pregnancy. Why is that? It takes the body time to recover after pregnancy. So again, how much time should you wait before undergoing a Mommy Makeover after pregnancy? The answer is typically 9 to 12 months. However, it can be longer if you breastfeed longer. It can be right there if you don't breastfeed and you're not planning to have future pregnancies if you want to undergo an abdominoplasty, because we're putting your abdominal wall back together, and we don't want to put it back together if you're planning to have more kids and they separate. So again, when we're looking at timeline to undergo a Mommy Makeover after pregnancy, it depends on the patient, it depends on the goals, and it also depends on the procedure you're undergoing. Because again, a Mommy Makeover is a general term for a breast procedure combined with a body procedure. And it's not always the same procedures. So it needs to be a very customized approach. It needs to be discussed in depth with the patient so that the understanding of the expectations, the safety, and the results are what you hope to get. So what I'm always preaching to my patients is there is no rush to this. Do it when it's right for your body. Don't do it when it's right for the surgeon. Don't do it when it's right for anyone else. It needs to be when it's right for the patient's body after it has full time to recover after the pregnancy, after their breasts have gotten rid of all of that milk that has produced from the pregnancy and or from breastfeeding, so that when we are able to undergo this procedure, the results are what you expect, and that you don't have to have any further surgeries done because you did it too quickly and you didn't give your body enough time to heal. So again, how much time should you wait to undergo a Mommy Makeover after pregnancy? typically at least 9 to 12 months, but it depends on each patient. So you need to make sure that you discuss this with your plastic surgeon. If you have any further questions about mommy makeovers, reach out to me or my staff. We're always happy to answer your questions.